Good evening and good to have you with us in this edition of the Urban Debate. And as festive season kicks off with celebrations across the country, I am back with one simple basic reminder. Coronavirus still hasn't gone away. Before we get to that, let me tell you about this recent government panel report that's emerged on coronavirus and what it projects and predicts for future on the basis of the trends so far. Finding number one, that the lockdown did help us save lives. Finding number two in this report that's been released by the center is that COVID-19 has peaked in our country. This is good news. And if you see recent daily data, you will see a similar trend. It does look like we've managed to now come down from the worst point we were at. Finding number three, winter may increase the spread. This is very, very important. This is what Mirror Now has been telling you now for several weeks, that the winter season, the cold season may add to our challenge. Finding number four, pandemic is likely to end by Feb 2021. Now, this is basically a mathematical projection that has been done to see where the cases are almost coming to a bare minimum. Doesn't mean the COVID is going anywhere else. Until we find a treatment or a vaccine, we're going to have to live with coronavirus. Finding number five, 105 lakh projected cases by Feb 2021. But also the report says that lockdowns are now undesirable, that while the precautions should continue, we shouldn't have any more lockdowns. In fact, finding number seven is the important one. You should continue with your precautions. Finding number eight, we should move to fully resume activities. Finding number nine, 30% of India's population seems to have developed some kind of immunity. Finding number 10, no sharp rise in cases due to the migrant movement. Again, this is basic, the data which is available so far. Now, while this report says that the pandemic can be controlled, that we should resume activities, the center itself, viewers, and repeatedly, Health Minister to Prime Minister, everybody has warned us that we need to be careful amid festivities, which is now, as we speak, that we need to follow the COVID norms. Unfortunately, the ground reality, which is on your screens right now, isn't really showing that. A Mirror Now check ground report shows blatant disregard of COVID norms. I mean, I don't really have to say, the visuals tell you the story. People are not even wearing masks. People are in crowded markets, in crowded places, preparing, shopping for festivities without masks. Add to that the challenge that citizens, more people, will travel back to their home cities and hometowns, their native places, so that really spikes up the challenge. And then there is a trend that shows that citizens are socializing more. There's only so much of lockdown that we can take. Netas and cops are reluctant to enforce norms, barring a few parchis that are being signed off as fine for not wearing masks. Largely, the strict implementation is missing. So tonight's conversation is about this, that while yes, we seem to have crossed over our peak, the danger hasn't gone away. So why are we behaving like this? Are we mentally prepared for what we may be headed for? And what roles do the states have to play in terms of tougher implementation of COVID norms during festival season? Before I go across to our panelists, let's quickly go to two reporters who are joining me right now. Shrija is joining us from Bengaluru, from one of the busiest markets, and Alok from Delhi. Alok, let's begin with you. Which market are you currently at, and what's the atmosphere there?
Well, Tanvi, I am standing at Chandni Chowk, and everybody knows about what kind of situation always remains at Chandni Chowk. Although corona pandemic came, but the situation is not at all changed over here. In fact, I am just showing it to you the visuals that by the visuals you can clearly get the sense that what kind of social distancing is being followed over here. there is a temple also, and you all know that the festival of Navratri is going on. So definitely the people are crowded at the temple as well. But not only that, here is the shopping market, and this is very famous shopping market which I am showing to our viewers. And this is one of the famous market of the national capital. In fact, this market is famous all across the world. That once Delhi's name comes in the mind, then Chandni Chowk also comes in the mind. So if you see the other side, my video journalist Ajaz is showing you that there you can see this is a huge market lane, and everybody, you can see the crowded people are standing. Many are not wearing masks as well. In fact, one of the person who is sitting here only, he is not wearing mask. You can clearly see that the person is not wearing mask. So this kind of situation we are seeing in the national capital, and this is not the view of one place, one market. Across the national capital, everywhere we are noticing the similar kind of that the violation of the social distancing. In fact, if you talk about the figures that the Delhi police is also on the ground, they are issuing around 500 rupees of challan. In fact, Delhi government is also issuing 500 rupees of challan if the person is not wearing mask or they are not following social distancing as well. But despite that, all these things are happening. Definitely, the people need to very much careful while they are on the streets, while they are doing marketing. Definitely, it's a festival time, but they have to be very much careful. Back to you.
Well, they're definitely not. Alok, like you said, Chandni Chowk is which is one of the busiest areas, and it seems to be back to its glory days of festival time, where people, throng in large numbers, shop and eat, all the delicious food that you get there. But unfortunately, we are forgetting what times we live in right now. Shrija, where are you right now? And is it any similar to the scenes that Alok was showing us from Chandni Chowk?
Well, absolutely, Tanvi. In fact, I am standing at Shivajinagar. Now, this is one of the busiest shopping destinations and in Bengaluru. And what you can see, the top angle shots that my video journalist is showing, you can clearly see the crowd. And imagine we are talking about a pandemic situation, and Bengaluru, in fact, takes the top spot amongst the rest of the other 30 districts here in the state of Karnataka. And you continue to see the crowd. Remember, the place that I'm standing right here is Shivajinagar area. Now, this is one of the areas in the city of Bengaluru that reported the maximum number of super spreaders, and this was also a containment zone. Now, despite reporting this several times, we continue to see people coming out in the open. They are shopping. Of course, this is not lack of awareness, but clearly lack of seriousness. Because remember, initially when the BBMP had imposed a fine of nearly 1,000 rupees, we understand people who did not wear masks, in fact, the cases were much lesser. But now we see the fine has been brought down to nearly 250 rupees. And every single day, the cops are booking at least anywhere between 2,000 to 2,800 cases. So you must understand that how the situation is grave as far as Bengaluru is concerned. And also to talk about the active cases that we are looking at in the city in Bengaluru, it is almost 67,000, which means of the 1 lakh active cases in the state of Karnataka, it takes the top spot here. And we also continue to see people not maintaining social distancing. They're of course not wearing masks. And even if you see people wearing masks, they are not wearing in a manner where it should have been worn. So this is the condition. In fact, we also did show you the visuals of another market, which is KR market. Situation continues to be the same because this is one of the markets amongst the rest of the other popular markets like Chickpet and KR market, we understand, was shut down completely only because where they reported super spreaders. And we also see the constituency did, of course, talk about this is not the time where they have to throw open the business. But now what you see right behind me is people are openly venturing out. They're clearly ready to take the risk. And of course, Karnataka government has also issued the guidelines for the festivities. But clearly, you do not see as far as social distancing or wearing of masks are concerned.
Okay, thanks so much, Rija and Alok, for bringing us, those ground reports. Shortly, we'll also do a quick check here in Mumbai. Mumbai has already gone through one of the big tests, which is when we had the Ganpati festival here, and we did see a lot of crowding. Now with Navratri on, I don't think the scenes are going to be any different, but we'll go across to Disha in just a bit. Thanks to Shrija and Alok. Let's say very quickly, good evening to the panelists who also joined us right now. Mr. Sudesh Varma, spokesperson for the BJP, joining me right now. Dr. Samir Dalwai, NCP spokesperson and developmental pediatrician. I also have Tanvi Das, political analyst, ATMC supporter. Dr. Anand Bhan, researcher for global health bioethics and health policy, joining me right now. Dr. Bhan, let me start with you before I go across to the political representatives. Should we just stop hoping for any more social distancing? You know, the kind of population density we have, the kind of discipline we've shown for all this while, maybe people are just fed up. It's festival time. This is it. No, can't be done anymore.
Thank you for having me. It looks like that, right? The visuals you've shown on the screen are testament to the fact that we are actually dealing with probably a fatigue of some kind at multiple levels. And it's a bit scary because while over the last couple of weeks, we've seen some encouraging trends in terms of plateauing of the number of cases, it could easily go up. We've seen that happen in Kerala post-Onam. And now that we have winter setting in, we have the possibility of increasing pollution. We have the festive season already on, right? Stretching from Diwali all the way to Christmas and beyond. It's potentially a scary prospect. This morning I was driving to work and I saw 4 young kids going to school, MPs among the states which have opened up schools for class 9 to 12. And all 4 of them were cycling to school, not wearing masks, and I just skipped a heartbeat. I was worried about the fact that these kids were going to go to school, potentially get infected, take that infection back home, and someone at home who was comorbid or old could get infected and potentially get severely compromised or die. So the risk is all around it. We've seen the worst of it. I don't think that needs to be reinforced enough. If we all don't take precautions, then the positives that we've seen over the last couple of weeks we could easily see a second spike happening, and that is what I think all of us worry about.
Well, thank you for being so straight and direct about it, that if you're not careful, then maybe the gains that we've made in the last few weeks will all be lost. I'm going to request all my other panelists for just give me 2 more minutes. I very quickly just want to bring a ground report from Mumbai as well. Disha's here. Disha, where are you? What's your location? And, what's the atmosphere around you?
Well, Tanvi, here I am in Mulund's Market, which is in the central suburbs of Mumbai, and this is also one of the very busiest, one of the biggest and the oldest market in the city. And as you can see, during the festive period, because Navratri is going on, Dussehra is just around the corner, and as far as Diwali is also concerned, this is the place which attracts a lot of footfalls. But here on the ground level, we are looking at not a lot of people really obeying with the simple and basic norm of wearing a mask also, for that matter. And this is the place where we get everything from clothes to jewelry, everything that one can ask for. And like you can see that people have also come out to shop for festive period. Remember, Tanvi, these are the markets which we usually saw pretty much crowded during, specifically in the evening hours before Ganesh Chaturthi, and after Ganesh Chaturthi we saw a sudden spike in the COVID cases, including a lot of deaths as well. So this is the festive period. Although government has laid a lot of SOPs, but on the ground level, it is at the end of the day the citizens who have to maintain social distance. Here, of course, in this particular market, we are looking at a little bit of less footfall because it's probably 8 o'clock, it's Monday, it's a weekday. But here, of course, the other market that we visited, which is Dadar, it was pretty much crowded. No social distancing, people not wearing masks as well. So festive period, definitely it is going to be a little bit worrisome because we have seen it, the biggest example of Ganesh Chaturthi in Mumbai.
Oh, well, Dadar is Mumbai's Chandni Chowk in that sense, always crowded, and that's irrespective of what time of the year it is. But yes, where Disha is right now, relatively lesser crowd. Mumbai has also gone through and seen the impact of what happens when you let your guard down completely, what we did, to a certain extent during the Ganpati time, and we've seen what happens then. Thanks, Disha, for joining us. So let me just go across to our panelists then, and maybe Samir Dalwai, start with you. To what extent do we now put this responsibility on people? And what's the role of the government and the authorities to still try and implement the rules, fine people, penalize them, and remind them that COVID is here?
So, good evening, Tanvi, and I'll begin with borrowing your words when you said that we lack the discipline to do things which we are expected to do. So, you look at the health, overall parameters where we follow orders. You look at people breaking traffic signals, you find people spitting on the roads always. So, we are not basically a clan which is used to following instructions, especially for a prolonged period of time. The other part that my friend Dr. Bhan just alluded to about fatigue. Let me tell you that I think one of the biggest aspects of this pandemic which we have ignored is the psychosocial aspect. And as a pediatrician, I'm seeing a tremendous increase in the rise of number of children being reported with anxiety, and even, of course, adults coming with anxiety. And this anxiety is bound to make us go out, and it's going to be very difficult to be indoors and to apply all these social distancing norms. So this is going to be a big threat to our social distancing. Having said that, the government and all of us need to recognize these challenges and adapt for them. Because if you see the report, the interesting part is it says that because of the restrictions and the lockdown, we have managed to secure an advantage. And it says now that you need not have a complete lockdown, but it also gives you the numbers that could happen if we kind of decrease the measures that are in place. So it says that if we current measures are continued, which includes lockdown in many, many places of India, it's about 105 lakhs. But if we do not take any measures or we reduce the measures, it could go to 176 lakhs or 137 lakhs. However, if the measures continue to be strong and stronger, we could get between only 83 lakhs to 92 lakhs. The point of the story is any study, any algorithm is only an horizontal study in time. The best of algorithms could not predict what happened in Kerala or what could suddenly happen. So we need to know one thing, and as a pediatrician, I can tell you that viruses stay for thousands of years. If this is a virus, there are only two ways you can prevent getting it. One is if you get the infection and you develop antibodies. Second is if you are immunized. Third is, of course, children, newborns who get it from their mother. There is no other way you can prevent getting this virus for sure, unless you observe social distancing and all the norms that we are talking about. And hence, I believe, especially in Maharashtra, I would commend the government for having taken the stance of not opening up it completely. And I think it's very important to maintain these kind of measures as long as we see a definite trend. Let's not forget Europe and other countries, especially cooler climates, are seeing a second surge. There is talk about a second lockdown in UK and many other countries. It would be disastrous if, because of the religious festivities and all that, if we completely are lax and open up everything, it could lead to a disaster. We have prevented that to a large extent so far. Let's not completely relax our caution.
Okay.
I would say that as a doctor first.
Okay, point well taken. Mr. Sudesh Sharma, what's your sense? To what extent is it the responsibility of the local authorities and states as well to penalize more, to regulate people movement, even in markets right now, or otherwise? We've now unlocked, and justifiably so. But there is a fear and a threat.
Yes, Tanvi, you are right. You see, the bold decision which Prime Minister Modi took of, having the lockdown, because that time nobody knew how this virus would react, and you knew that you could trace the person, but because of certain events, we could not prevent the spread. Still, the lockdown held, and this study shows that the Prime Minister actually did not bother about the economy and decided to save lives. And if people don't take precaution now, actually, it would be insulting that, temperament, that feeling, and the zeal with which it was taken. Because you see, we have to cooperate. When I'll tell you an example. Like in our society, Durga Puja used to happen every year, but this time there's no Durga Puja. Because people have realized that, these pujas can wait, the festivities can wait. Finally, you see, economy will pick up, but in your zeal to go to the market, to do some shopping, or, to do other economic activities, or to do such festivities without observing the mask rule and without observing the social norms, what you're doing is bringing down the entire edifice. We have good news, as told by the group of scientists, that yes, by February we would have contained this, and we have reasons to be happy that if you compare with Western countries, more advanced countries, that we have very good figures, and we should be happy. But at the same time, there is a fear also. There is Bihar elections. People are, not seen observing the norms. Then you have festivity season, and then you also have the winter coming up. So we have to take precaution, and there's no way out. And we all need to be more and more conscious. And it is for the state government to implement those norms, to create awareness. Because people, I'm surprised that young people think that no, we are young. It is for 60 plus people, comorbidity, but they don't know that they could be asymptomatic and they could endanger their parents who would be 60 plus. It is such feeling that needs to come to them, that you cannot take things for granted. Many big civilizations have been just evaporated like this, and people are still examining why it happened. So we have to take precaution. We have to save lives. Economy will also pick up if we maintain social norm and do our economic activity.
Yes, in fact, there's been quite a bit of conversation which has happened around states where there has been some or the other kind of festival, and they have seen a spike in cases. In fact, Kerala and the Onam festival being one of those examples. Now, while the Chief Minister says it's not about us giving in too many reliefs or lifting too many restrictions, but obviously with the amount of relief which is there is enough. If people want to go out and forget social distancing or don't wear masks, and in the numbers for Kerala, you'll see the spike that's happened in number of active cases after Onam. That's a big concern. So, Tanvi Das, isn't it the state's responsibility as well to tell people that yes, you need to celebrate, but maybe this time find other ways of celebrating the same festival?
The actual matter is not for only the celebration. Actual Bengal society is totally dependent on this Durga Puja. And not only that rituals we are celebrating, the socio-economic structure of our society throughout the year depend on this festival season. So the traders, as we know, after 6 months of lockdown, we don't have any money. They don't have any money to circulate the market. And what happened? That GDP is going down. We all know the situation. What is the situation? And if their annual source of income is cut off, what happened? They will starve to death before COVID. That is the problem we are facing. All we are facing. So Durga Puja cannot be stopped. But in this pandemic situation, we have to maintain some precautionary measures, and we can appeal to the people that you should use the mask, you should use the sanitizer, social distancing. We can appeal the people, but we cannot stop the Durga Puja. As the BJP spokesperson said that we are not irresponsible, but you have to know the Bengali socio-economic structure. You have to understand that the traders don't have any money in their hands to circulate the market. We create the market. We should think of it to create the market.
Yes, but we didn't. That's the problem, Tanvi Das. The fact is that we didn't. Until now, we should have had a plan. It's taken the Calcutta High Court to step in and pull up the Bengal government to say, where is your plan to regulate people? I mean, everybody knows the kind of crowds we see during Durga Puja, and of course people want to get out and celebrate, but there has to be some plan in limiting number of people who are coming and going at one point of time. How are you going to maintain social distancing or ensure that there are masks? The Calcutta High Court has pulled up, Tanvi Das, the Mamata government saying, where is your plan? Restrict the number of people at one point inside the pandal to only 25. Sudesh Verma, you wanted to make a point? Go ahead, please.
Tanvi, nobody has any word against puja.
Correct.
We ourselves are demanding that Maharashtra government should open the puja asthans. Why? Because
that's
puja
an
should
interesting
happen.
point.
Tradition should go on. What we are saying is, you maintain the social norm. No, why can't we be disciplined? Especially for 6 to 7 months. Once the vaccine comes, then life probably will go back to normal. And God forbid that the government will have to impose a nationwide lockdown again. No, nobody should do that. We want the entire economy to open, but please exercise precaution. That is what is being said. The three things: wear the mask, use sanitizer, maintain social distance. It's simple if you see that. And you don't need to buy a fancy mask from the market. You can make it at your own home. People are doing it. That is good enough. So please maintain it. Please maintain social distance. No, this is something that can be done anywhere, whether it is Durga Puja, whether it is Bihar election, or whether it is any of the festivities that is happening. If you don't maintain that, then there is a problem. And it's just a matter of few months. Life is anyway more important than any of these things, So that is what we are saying. The state government should implement it, should hold itself responsible for doing it.
No, that exactly my point. Yes, you should allow festivities. Yes, you should allow people to come out to a certain extent. Maybe let it be their own decision. Ideally, they should be celebrating at home and not indulging in large group activities. But they do. The question is, Tanvi Das, where is the plan? And especially for a state like Bengal, where this festival is otherwise usually held at a grand scale.
Look, Santosh Mitra Square, if you heard this name, I don't know. Santosh Mitra Square is a large amount of people are everywhere visiting that festival. They have already declared that we don't need any visitors. Not only that, pandal, that we love to do the pandal hopping. That is our favorite chapter in this festival season. But the big organizer of the puja, they have already declared that we don't need any visitors. Just from your home, you can, many apps already coming out in our mobile phone, and they're requesting us to, from home, you can enjoy your puja pandal hopping. And we are taking the steps. We are trying to do something with these issues. But you have to put in your mind that what is the actual problem is the market. What I'm saying earlier, that the market, we have to create the market situation. We have to make the people, we should create something that people can doing their business well and get some money from the market.
Okay.
That is the main situation.
So I know the Samir Dalwai wanted to make a point as well on religious places or festival, organizing festivals. But before that, Dr. Anand Ban, here is the conundrum there. On one side, the argument about all the economic activity, the livelihoods that depend on such grand events versus the infection, the COVID, fear of the spreading COVID itself.
Yeah, it is a balance, isn't it? I mean, I think the economic repercussions of COVID-19 are not unique to the festival season. These have been around for quite a few months, and I think many decisions, probably policy-wise, were driven by the fact that there was a economic downturn and many families were suffering either due to job losses or the fact that they were not able to go and market their produce, etc. And this is going to be around for the next few months also. So it's not, it's going to go beyond the festive season. The real question is policy-wise, government-wise, what kind of a balance do we need to bring in, and what is the role of state regulation versus individual responsibility, and how do we marry these two in a way that we get some effective public health precautions happening. It's not going to happen overnight. It requires, as you were pointing out, planning. It requires standard operating procedures. It requires practicing those. It requires an implementation strategy. It requires an evaluation plan which sees what is working, what is not working, what needs to be reinforced, what needs to be improved on. And it requires constant partnering with local communities. At the end of the day, if communities and individuals don't adhere, then you can have the best plans and they're not going to be effective. So the only plans which are going to work are the ones where there is local ownership, where people recognize these as plans which will protect them, their families and their communities, and where they will show adherence to them. So if that means that you need to have pandals which are much more smaller, which only allow limited number of people, which are ideally open and not closed spaces, because we know closed spaces are conducive to the spread of infection, then probably those are the kind of steps we need to take and ensure that local community leaders, those who set up these pandals, so the local organizers, they are all on board on this decision. And the use of innovation, absolutely. If you can use technology, then yes, in areas where technology has that penetrance that people are able to follow the pujas, etc., on their mobile phones, excellent. But in rural areas where that might not be a possibility, we need to get that messaging out to ensure that overcrowding doesn't happen at these sites, and that we don't have negative repercussions of this festive season post the festive season.
Are we ready, Dr. Bhan? Are we ready for that kind of a setup now? We use the lockdown to build our healthcare infrastructure, but will we be prepared if there is another surge?
So I think we're going to struggle. We know we've struggled in the past as well. I think there's been positive, certainly. The model we are talking about, the Indian National Supermodel, seems to indicate that the lockdown has had a beneficial effect in terms of preventing an early surge, and that's probably true. But we also know that lockdown was a period where we had to build up our healthcare infrastructure, our beds, our ventilators, and our human resources. And we've been a mixed bag at that, right? Even now, we know that in many states, there are concerns about having adequate infrastructure. And at times, the whole health system was creaking with the burden of COVID cases, and on top of that, the non-COVID-19 care which was required. So I don't think at any point of time we can say that we are prepared. I think it's good to predict the likelihood that there could be some increase in the number of cases, but the best precaution we can have is preventing us from getting to a place where our health system is again stretched out, because we know that we can have the beds, but we don't have adequate doctors, nurses, paramedical staff, and they're not going to be produced overnight. So going into winter season with other viral diseases likely to spread, etc., our saving grace is going to be making sure that we follow these precautions. Let's not put our health system at undue risk of collapsing, which is a likelihood if the number of cases keep on spiking. We are in a relatively better place right now. Let's try to keep it there and keep improving.
Dr. Samir Dalwai, you wanted to make a point?
Yes, well, to simplify to what Dr. Bhan said, the Indian Academy of Pediatrics came out with a detailed document about reopening of schools.
Yeah.
And it made a very important statement. It said it should be decided not at the national level, nor at the state level. It should be decided at the district level, or even at a smaller level than that, taluka level, because it needs to have local issues into consideration. I also completely appreciate my friend Mr. Verma's passion for saving people's life, as well as my friend Ms. Tanvi Das's passion for looking after the economic well-being of children, and that's the conundrum you are talking about. It's equally important to understand about the economic part that she was making and the healthcare that Mr. Verma was saying. The only way we can walk this tightrope, Tanvi, is if we avoid getting inter-party politics into it. Just till yesterday, we were debating in Maharashtra hotly about having the BJP clamoring to open up all religious places. That was a debate that was happening till yesterday. Somewhere else there's some other debate happening. It's, at this time we should not be looking into, like he mentioned rightly, that the Prime Minister went in for the lockdown, and I must say that every political party in India supported him entirely, and neither was the Prime Minister nor the opposition making a rocket science point. It was common sense after what we saw everywhere, and everybody had to come together and support it. Unfortunately, now with this unlock happening, we need to show that same spirit, and we should not fight petty political battles, because these will be fought over the lives of our ordinary citizens, especially the poorer ones. So I think that point is very important, that if we keep politics on the back burner right now and we only focus on at a micro level how to get the best thing through. Let's not focus on whether Bihar has an election or whether Bengal has an election or whether Maharashtra has a different political spectrum in rule. Let's not look at that. I support Mr. Verma's plea that it is the emotional aspect of saving people's life that is most important. And yet, while doing that, if we can look at what Ms. Tanvi Das said about, at least at a micro level, about the economy being revived, I think that would be great for all of us in India.
Okay. Yes, Sudesh Verma.
You see, I agree to most of the points you said, but you see, you must respond as a democratic government. When we say that you have opened the hotels, you have opened wine shops, you have opened malls, you have opened cinema halls, and then yet you put a restriction on religious places. If you agree that these religious places also are economically linked, to people's life, because there is economy involved in that, then there is no reason for not opening if you impose the same restrictions which you do on other activities. That is the only small point, and rest we all agree that yes, social distance norms have to be maintained and the society must move forward. We cannot live under the threat of COVID forever. Just maintain these norms and please, economic activity must go on in every sphere. We are for that. God forbid, I'm repeating it, that the situation should not become as such that lockdown needs to be reimposed. We would not like to have that because the economy has already taken that slide and it has to go up now. We are competing with world powers. And that is why it should be seen in the context, And I said and I reiterate that most civilizations, old civilizations,
can I just comment, Tanvi?
God knows why it happened.
Okay, no, so let's say this. Let's just put it like this. Yes, Samir Dalwai, if we can, unlock and open up all other places and put in regulations and restrictions, if restaurants are open with 50% capacity, if now gyms and fitness centers will be allowed to open again on the economic, reason, then why not places of worship as well? I mean, don't open doors to thousands of people together like we've seen in the past, but yeah, open the doors.
Tanvi, for the third time, let me say I support Mr. Verma's passionate plea to save lives. I support that. Let me give you one small thing to end this debate. The last census showed that India's population, 1% people were atheists, which means 99% are religious. Out of 130 crores, that's probably 128 crores are religious. How can you stop 128 people from coming out and expressing their religious fervor? And I'm sure by any stretch of the imagination, nobody in the BJP can say that 98% of India's population is alcoholic, or they go to pubs, or they go to cinema houses. So this is not a debate, Mr. Verma, that we must get into. Let me complete one more thing, bhai, one more thing. Why don't you compare religious places with pathshalas? Why are we comparing dharmashalas with madhushalas, according to the BJP's debate? Why don't we compare pathshalas to... No, we are not giving preference. That's the economy that can be managed. It's a small proportion of people, mere bhai. When we talk about schools, that should be compared to religious places. Schools,
whereas economy of other people depend on the temple.
All right, so let's
about political rallies.
Yes, let's come back to this point. We've had this conversation about places of worship earlier as well.
Tanvi, can I add, if anxiety was the issue about which he spoke so passionately, then anxiety you can get rid through religious activities, isn't it? People go to God in
Christ. भाई भगवान और अल्लाह मंदिर मस्जिद में नहीं है, इंसान के दिल में है.
Okay. Coming back to the main conversation right now. Today, the conversation is about festivals. And the fact that repeatedly, all health experts, even the government itself, even in the report, Mr. Sudesh Verma, that's been released yesterday, which otherwise projects that by February, we may not really have COVID in the sense, in terms of a significant number of cases, that it will be gone. It still says that winters and festival season is a challenge. But to what extent, how do we handle this? I mean, is there a state regulation example that you can give from any of the BJP states, or is there a need for the center to come in and say, okay, wait a minute, maybe these 5 rules need to be implemented again?
So it would be difficult and it should be naive rather to claim credit for anything or blame any government for that. You see, we have to act as society. There could be any government in any state, I cannot say that one state is doing better. It is for every state government, because central government, our job is to give directives. Our job is to learn from the experiences and enable them. And after that, it depends on the state governments to implement it. And it depends on the people to accept. So it is much better if you create awareness of a kind that never existed. You must show them the examples. Because, people are losing lives. It's not that people are not losing lives. And it must come down to people that they must take precaution. And first of all, it should happen through awareness. And after that, of course, imposition of fine is also a way out. But you should also understand that when they're not earning anything, imposing a fine could be disastrous for their family, So it is much better that you find out ways how you're going to do that. And community, policing would be the best thing. Like in our society, I can tell you, some people were not using masks. They were, asked by people, ordinary people, that why you are not wearing. Some people will like to deviate, but you have to ensure that it happens. You don't have to call the police to make them aware. Community policing would be the best thing to do.
Okay, let's say good evening to Dr. Sanjeev Bagai, joining us this evening as well, Chairman for Nephron Clinics. Dr. Bagai, the debate, the conversation really is about the big challenge of festivals. We've seen in some cases in the past, in the last 6 months, where festivals have been celebrated in a muted sense or in a grand sense, and there's been a direct relation with the number of COVID cases in that area. Now, as all of us, deal with our own COVID fatigue, how do we beat this challenge, this festival season?
I think festivals will come every year, Tanvi. I think we need to keep health and people's life, family lives above everything else. Just to put things in the correct perspective, festivals bring about a lot of people who go out in large gatherings, who are very close to each other. The social distancing norms obviously will not be maintained. They cannot be maintained. A lot of them will not wear a mask. A lot of them will be eating the wrong stuff and increasing the comorbidities. I think this is clearly a time in which we need to take stock of the situation. It's been a long walk for the last 7 months. We still have another few months to walk through this path. It's been tough for everyone. But to put religion above science, I don't think will be wise at the present moment. Keep in mind 2 add-on factors. One is the winter, in which the temperature and the relative humidity will increase the spread of the virus. And point number 2, and very critical, is the air pollution, which will also exacerbate the diseases, mainly things like what we call as common flu, which is influenza. And therefore, I would say it would not only be a pandemic in the winter, we may land up with a twindemic. That means COVID-19 and the H1N1 influenza. That's well worth avoiding at the present moment.
So where
can I come in, please?
Yes, no, just one question, follow up to Dr. Bagai. Whose responsibility is it? Of course, it's the people. We need to self-discipline. We need to keep in mind to wear masks, to maintain distance. But outside of that, Dr. Bagai, would you also hold the governments and administration responsible to have some kind of regulation, rules, and even penalize those who break the rules?
The countries and the societies which have fought this COVID-19 the best are the ones who are most disciplined. I've always said this, and for many years, that health is neither a state subject, neither it's a central government subject. It's an individual societal subject. It is up to us how well we are disciplined. It is up to us how well we follow the advice and norms. The government, whether it be central or state, has done a phenomenal job. I don't want to take away the merit which all the administrators actually deserve, because it's been a monumental task in these last 7 months to reach where we are. And having said that, India is running perhaps one of the lowest mortalities per 1 lakh population. It's less than 0.5%, whereas Belgium and UK and Spain and France have actually reaching 70 to 80 deaths per 1 lakh population. So I think it's more an individual discipline which we need to follow. In the festive season, there is bound to be crowding. We know that the crowded areas will have an attack rate of almost 87%. That means the chance of a person transmitting this infection to his friend, his family, his neighbors, or other people who are so-called celebrating is 87%. Is it worth it? Answer is no. Are you going to transmit it to a whole lot of other people? The answer is yes. Why spoil the game at the last stage?
Dr. Ban, you wanted to comment?
Tanvi, can I come in?
Yeah.
Yes, then Samir, I'm coming to you. Yeah.
Sure. So I agree with Dr. Bagai. I mean, just to maybe add on what we've learned from dealing with earlier pandemics, and also, the experiences of dealing with HIV, TB, etc., and actually polio as well, is that you also have to get local leadership on board, and that includes religious leaders. So, we don't need to make it into a religion versus science debate. If we can get the religious leaders on board, they are at risk as much as all of us are. We have unfortunately lost a few religious leaders to COVID-19 as well. Let's try to get them to be allies of ours. We need them to actually step up and talk about these things that maybe people will not listen to you or me or, doctors or public health experts or even politicians, but maybe they might listen to some of our religious leaders, or at least some of them will. And it's time for our religious leaders to come forward and take the responsibility of being leaders of large congregations and talk about the risks attached to religious followers. Religion is not going to save you against this virus, unfortunately, but common sense just might, and hopefully all of us can remember that. So let's celebrate. Let's celebrate in our families. Obviously no one wants to miss out on the festive season, but let's not celebrate the festive season by putting ourselves and our communities and those around at undue risk. And I think that's the one message we all need to reinforce.
Oh, yes, absolutely. But, sometimes I just feel as if we are in another world where we have these conversations, and then you look out and you see what's happening outside of our worlds and outside of our homes and studios, and the whole world is completely different. And we've had instances where there have been, religious processions, grand events with hundreds and thousands of people and then crowding together. With absolutely no fear. Now, I don't know, there isn't any scientific evidence that any of our governments have given us if that's actually led to a spike, barring what the centre says about Onam festival, or even the central, report said a few weeks earlier about in cases going up in Maharashtra post the Ganpati festival. But outside of that, we don't know if these large congregations and processions have led to a spike. Yet, keeping that aside, I still want to emphasize that the danger is very much there. And we are still looking at, a number of cases that are running into lakhs on a daily basis. And that stress on our system is still very much there. We don't realize it until it happens to us. We don't realize it until it happens to our loved one. Only then, when we go through the entire process of running around, getting tested, figuring out whether we want to be in hospital, don't want to be in hospital, where do we get tested, where do we get the ambulance, who's going to look at us, the doctor's not coming to look at us, that's when we realize the gravity of it. Samir Dalwai, you wanted to make a point. Go ahead, please.
One is, Tanvi, I've had an experience of going through it in the last month with family. The second is Dr. Bhan's point about not making it a science versus religion debate is worth its weight in gold and should be replayed on your channel.
Yeah.
Because religious leaders have to be enrolled to be the real advocates in the community. That point which he made is fantastic. Whether it was oral polio or MMR, measles vaccine drive, we succeeded only when we got in the religious leaders to appeal to their own communities. The third danger is very important, not to make it an inter-religious kind of an argument again, which again has unfortunately politicized as time. I just want to close by saying that there are 2 points which fly against the overall recommendations of this report. And those 2 points, again, interestingly, are made by a brilliant pediatrician, Dr. V.K. Paul, who's also a Niti Aayog member. And he has cautioned about a second wave of COVID-19, much like Dr. Bagai sir said just now, which could occur in the coming on winter months. Again, we need to remember that winter is not equally severe in every part of India. So again, it will be best left to the local authorities to figure that out. The other thing which Dr. Paul has very importantly said is that 90% of people, according to the Niti Aayog report, are still susceptible to new infections. So it's only about 10%, according to Dr. Paul, who are having this immunity. So we are far away from herd immunity. And the third and the last point I'd like to make is, across the world, unfortunately, disastrously, we are seeing some cases of reinfection as well.
Yeah.
And let's not forget that people are saying that the antibodies which do give you immunity are sometimes valid only for about 3 to 4 months. Sure, Dr. Bhan can shed more light on that. In which case, already 7 months have gone. People who have been infected and have got out of it now risk, at least to a theoretical level, a risk of reinfection. So I would again, as a doctor and as part of a government representative, say that we need to be very, very cautious. Religions and festivals are very important. We miss meeting our friends and family more than anything else. That even if we celebrate our festival in our house, we will miss that, meeting friends. But like Dr. Bagai said, festivals will come and go, but life is only for once.
So I just want to go back to Tanvi Das on one aspect. Tanvi Das, then what's the alternate, say, for festivals like the Durga Puja, where hundreds do throng on the streets and in the pandals, and I mean that's pretty much the charm of the festival itself. Like you said, that it's more about pandal hopping, as a group and a family, which is essentially what the festival means to most Bengalis. What's the alternate there that people in Calcutta could look at?
Today, High Court has given an order that all the pandal zone will be the quarantine zone, and we cannot do the pandal hopping. That is a very bad thing, but we should maintain the law. But one thing that Durga Puja, we cannot stop it. We cannot, Durga Puja cannot be stopped. So we have to do this, and we have to celebrate according to our, after maintaining the measuring precaution and all the precaution we should take, that what the health precaution is should be taken. And then after that, as I have told that many apps is coming to maintain that pandal hopping.
Virtual
And,
pandal hopping tour. Maybe
Yeah.
that's the way to go. I don't know how many of these pandals we'll be able to see that way, but maybe that's a good way to go about it. And cook for yourself at home and have all those delicacies that are usually associated with this festival as well. I am completely out of time. Thank you so much to all of our panelists for joining us. Hope you all also have a great festival season, and so does every viewer of us. But please don't forget this. COVID challenge remains. There is a challenge that we may again see a spike in cases if we are not careful. And the visuals we've brought to you from various cities, and through the day our reporters have been in different cities, is that people are not being careful. And this is not going to be good for any of us, for any of our cities and towns. No matter how well prepared we are in healthcare infrastructure wise, a sharp spike will become a big challenge. And remember, cold season itself is a challenge. Perhaps helps coronavirus too. We'll have to wait and see how it goes. But keep these precautions in mind. Wear your mask, maintain your distance. Have a great festival season. Thank you so much for joining us on this conversation.